How common is cancer? Cancer is a common disease that can affect almost every part of your body. About 39.5% of all people will be diagnosed with cancer at some point in their lives. How cancer begins: cells are the basic units that make up the human body. Cells grow and divide to make new cells as the body needs them. Usually, cells die when they get too old or damaged. Then, new cells take their place. Cancer begins when genetic changes interfere with this orderly process. Cells start to grow uncontrollably. These cells may form a mass called a tumor. A tumor can be cancerous or benign. A cancerous tumor is malignant, meaning it can grow and spread to other parts of the body. A benign tumor means the tumor can grow but will not spread. Some types of cancer do not form a tumor. These include leukemia, most types of lymphoma, and myeloma. DNA exists in the individual genes of every cell. It has instructions that tell the cell what functions to perform and how to grow and divide. Mutations occur frequently in DNA, but usually cells correct these mistakes. When a mistake is not corrected, a cell can become cancerous. Mutations can cause cells that should be replaced to survive instead of die, and new cells to form when they're not needed. These extra cells can divide uncontrollably, causing growths called tumors to form. Tumors can cause a variety of health problems, depending on where they grow in the body. Types of cancer: doctors divide cancer into types based on where it begins. 5 main types of cancer are: 1. Carcinomas. A carcinoma begins in the skin or the tissue that covers the surface of internal organs and glands. Carcinomas usually form solid tumors. They are the most common type of cancer. Examples of carcinomas include prostate cancer, breast cancer, lung cancer, and colorectal cancer. 2. Sarcomas. A sarcoma begins in the tissues that support and connect the body. A sarcoma can develop in fat, muscles, nerves, tendons, joints, blood vessels, lymph vessels, cartilage, or bone. 3. Leukemia. Leukemia is a cancer of the blood. Leukemia begins when healthy blood cells change and grow uncontrollably. The 4 main types of leukemia are acute lymphocytic leukemia, chronic lymphocytic leukemia, acute myeloid leukemia, and chronic myeloid leukemia. 4. Lymphomas. Lymphoma is a cancer that begins in the lymphatic system. The lymphatic system is a network of vessels and glands that help fight infection. There are 2 main types of lymphomas: Hodgkin lymphoma and non-Hodgkin lymphoma. 5. Melanoma. Sometimes cancer can develop in the cells that pigment your skin. These cancers are called melanoma. How cancer spreads. As a cancerous tumor grows, the bloodstream or lymphatic system may carry cancer cells to other parts of the body. During this process, the cancer cells grow and may develop into new tumors. This is known as metastasis. One of the first places a cancer often spreads is to the lymph nodes. Lymph nodes are tiny, bean-shaped organs that help fight infection. They are located in clusters in different parts of the body, such as the neck, groin area, and under the arms. Cancer may also spread through the bloodstream to distant parts of the body. These parts may include the bones, liver, lungs, or brain. Even if the cancer spreads, it is still named for the area where it began. For example, if breast cancer spreads to the lungs, it is called metastatic breast cancer, not lung cancer. What are the 4 stages of cancer? Most cancers have 4 stages. The specific stage is determined by a few different factors, including the size and location of the tumor. Stage 1. Cancer is localized to a small area and hasn't spread to lymph nodes or other tissues. Stage 2. Cancer has grown, but it hasn't spread. Stage 3. Cancer has grown larger and has possibly spread to lymph nodes or other tissues. Stage 4. Cancer has spread to other organs or areas of your body. This stage is also referred to as metastatic or advanced cancer. Though stages 1 through 4 are the most common, there is also stage 0. This earliest phase describes cancer that is still localized to the area in which it started. Cancers that are still in stage 0 are usually easily treatable and are considered precancerous by most healthcare providers. How dangerous is cancer? Cancer is potentially fatal. Currently, it's the leading cause of death worldwide. However, Fatality rates largely depend on the type of cancer and how far it has spread. Many types of cancer are successfully treated with prompt care. Why is cancer so deadly? When cancer cells develop, they can disturb proper organ function. This can result in reduced oxygen supply and a buildup of waste products. If vital organ function is impaired, it can lead to death. What causes cancer? Several factors contribute to the development of cancer in your body. 1. Smoking and using tobacco products is one of the main causes of lung cancer, oral cancer, laryngeal cancer, esophageal cancer. 2. An unhealthy lifestyle. Eating high-fat or high-sugar foods can increase your risk for many types of cancer. 3. You're also more vulnerable to disease if you don't get enough exercise. 4. A toxic environment. Exposure to toxins in your environment, such as asbestos, pesticides and radon, can eventually lead to cancer. 5. Radiation exposure. Ultraviolet radiation from the sun significantly increases your risk for skin cancer. Overexposure to radiation treatment can also be a risk factor. 6. Hormone therapy. Women who are taking hormone replacement therapy may have an increased risk for breast cancer and endometrial cancer. 7. Heavy alcohol consumption. 8. Poor nutrition. 8. Currently, the most significant unpreventable risk factor is age. According to the American Cancer Society, doctors in the U.S. diagnose 87% of cancer cases in people ages 50 years or older. Is cancer genetic? Genetic factors can contribute to the development of cancer. A person's genetic code tells their cells when to divide and expire. Changes in the genes can lead to faulty instructions, and cancer can result. Genes also influence the cell's production of proteins, and proteins carry many of the instructions for cellular growth and division. Some genes change proteins that would usually repair damaged cells. This can lead to cancer. If a parent has these genes, they may pass on the altered instructions to their offspring. Some genetic changes occur after birth, and factors such as smoking and sun exposure can increase the risk. Other changes that can result in cancer take place in the chemical signals that determine how the body deploys, or expresses specific genes. Finally, a person can inherit a predisposition for a type of cancer. A doctor may refer to this as having a hereditary cancer syndrome. Inherited genetic mutations significantly contribute to the development of 5 to 10% of cancer cases. 10. Exposure to cancer-causing chemicals, called carcinogens. 11. Some existing health conditions that cause inflammation may also increase your risk of cancer. An example is ulcerative colitis, a chronic inflammatory bowel disease. Knowing the factors that contribute to cancer can help you live a lifestyle that decreases your cancer risks. According to experts, these are the 7 best ways to prevent cancer. A. Stop using tobacco and avoid secondhand smoke. B. Eat a healthy, balanced diet. C. Limit your intake of processed meats. D. Consider adopting a Mediterranean diet that focuses mainly on plant-based foods, lean proteins, and healthy fats. E. Avoid alcohol, or drink in moderation. Moderate drinking is defined as 1 drink a day for women of all ages and men older than 65, and up to 2 drinks a day for men 65 years of age and younger. F. Keep a healthy weight and stay active by getting at least 30 minutes of physical activity every day. G. Stay protected from the sun. Cover up with clothing, sunglasses, and a hat, and apply sunscreen frequently. Avoid the sun between 10 a.m. and 4 p.m. This is when the sun's rays are at their strongest. Stay in the shade as much as possible when you're outside. Avoid tanning beds in sunlight, which can damage your skin just as much as the sun. H. Get vaccinated against viral infections that can lead to cancer, such as hepatitis B and HPV. Risky behaviors. I. Don't engage in risky behaviors. Practice safe sex and don't share needles when using drugs or prescription medications. Only get tattoos at licensed parlors. See your doctor regularly so they can screen you for various types of cancer. This increases your chances of catching any possible cancers as early as possible. What is the first sign of cancer? Cancer symptoms can vary significantly for each person. However, there are a few things that could indicate the early signs of disease. Schedule an appointment with your healthcare provider if you experience unexplained weight loss, chronic tiredness, persistent pain, fever that occurs mostly at night, skin changes, an unusual lump, a sore that doesn't go away, hoarseness, dysphagia, difficulty swallowing, a mole or wart that changes in appearance. Please note that these symptoms do not mean that you definitely have cancer. However, if any of these symptoms appear, you should see your healthcare provider right away. Some general signs and symptoms associated with, but not specific to, cancer include fatigue, weight changes, including unintended loss or gain, changes in bowel or bladder habits, persistent cough or trouble breathing, difficulty swallowing, persistent indigestion or discomfort after eating, persistent, unexplained muscle or joint pain, persistent, unexplained fevers or night sweats, unexplained bleeding or bruising. Complications of cancer. Cancer and its treatment can cause several complications, including 1. Pain can be caused by cancer or by cancer treatment, though not all cancer is painful. Medications and other approaches can effectively treat cancer-related pain. 2. Fatigue in people with cancer has many causes, but it can often be managed. Fatigue associated with chemotherapy or radiation therapy treatments is common, but it's usually temporary. 3. Difficulty breathing. Cancer or cancer treatment may cause a feeling of being short of breath. Treatments may bring relief. 4. Certain cancers and cancer treatments can cause nausea. 5. Diarrheal or constipation. Cancer and cancer treatment can affect your bowels and cause diarrhea or constipation. 6. Cancer and cancer treatment may cause weight loss. Cancer steals food from normal cells and deprives them of nutrients. This is often not affected by how many calories or what kind of food is eaten. It's difficult to treat. In most cases, using artificial nutrition through tubes into the stomach or vein does not help change the weight loss. 7. Chemical changes in your body. Cancer can upset the normal chemical balance in your body and increase your risk of serious complications. Signs and symptoms of chemical imbalances might include excessive thirst, frequent urination, constipation and confusion. 8. Brain and nervous system problems. Cancer can press on nearby nerves and cause pain and loss of function of one part of your body. Brain cancer. Cancer that involves the brain can cause headaches and stroke-like signs and symptoms, such as weakness on one side of your body. 9. Unusual immune system reactions to cancer. In some cases the body's immune system may react to the presence of cancer by attacking healthy cells. Called paraneoplastic syndromes, these very rare reactions can lead to a variety of signs and symptoms, such as difficulty walking and seizures. 10. Cancer that spreads. As cancer advances, it may spread, metastasize, to other parts of the body. Where cancer spreads depends on the type of cancer. 11. Cancer that returns. Cancer survivors have a risk of cancer recurrence. Some cancers are more likely to recur than others. Ask your doctor about what you can do to reduce your risk of cancer recurrence. Your doctor may devise a follow-up care plan for you after treatment. This plan may include periodic scans and exams in the months and years after your treatment, to look for cancer recurrence. Reducing your risk of cancer. Treatment for cancer. The side effects of chemotherapy include hair loss. However, advances in treatment are improving the outlook for people with cancer. Innovative research has fueled the development of new medications and treatment technologies. Doctors usually prescribe treatments based on the type of cancer, its stage at diagnosis, and the person's overall health. Below are examples of approaches to cancer treatment. 1. Chemotherapy aims to kill cancerous cells with medications that target rapidly dividing cells. The drugs can also help shrink tumors, but the side effects can be severe. 2. Hormone therapy involves taking medications that change how certain hormones work or interfere with the body's ability to produce them. When hormones play a significant role, as with prostate and breast cancers, this is a common approach. 3. Immunotherapy uses medications and other treatments to boost the immune system and encourage it to fight cancerous cells. Two examples of these treatments are checkpoint inhibitors and adoptive cell transfer. 4. Precision medicine, or personalized medicine, is a newer, developing approach. It involves using genetic testing to determine the best treatments for a person's particular presentation of cancer. Researchers have yet to show that it can effectively treat all types of cancer, however. 5. Radiation therapy uses high-dose radiation to kill cancerous cells. Also, a doctor may recommend using radiation to shrink a tumor before surgery or reduce tumor-related symptoms. 6. Stem cell transplant can be especially beneficial for people with blood-related cancers, such as leukemia or lymphoma. It involves removing cells, such as red or white blood cells, that chemotherapy or radiation has destroyed. Lab technicians then strengthen the cells and put them back into the body. 7. Surgery is often a part of a treatment plan when a person has a cancerous tumor. Also, a surgeon may remove lymph nodes to reduce or prevent the disease's spread. 8. Targeted therapies perform functions within cancerous cells to prevent them from multiplying. They can also boost the immune system. Two examples of these therapies are small molecule drugs and monoclonal antibodies. Doctors will often employ more than one type of treatment to maximize effectiveness.